And welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is scapula. In the previous videos, we have already discussed about the bones like sternum, humerus, radius, and ulna. Now we will try to discuss the scapula, which is our upper extremity bone. Now, first of all, it is a triangular shaped bone. So, what is the shape of this bone? The shape of this bone is triangular. Okay, and it is 2 in numbers, both right and left. Now its position, it is situated in the posterolateral aspect to the back of the chest. So where it is present? It is present or situated in the posterolateral aspect to the back of the chest. Now, side determination of scapula. Side determination of scapula. Now, how to determine the side of scapula bone? Let us start. The first point, we know that at least we have to mention 3 points which are necessary for the determination of a side of a bone. Now, head or glenoid cavity or lateral angle. Now, the head or the glenoid cavity or the lateral angle is, or it is directed slightly upwards and lateral. That's why it was named also lateral angle, and it articulates with the head of the humerus and forming shoulder joint, which is a synovial joint, and subtype is ball and socket joint. So this is the first point, and the second point is spine or spinous process, that is directed posteriorly. Number 3, that is the coracoid process. It is directed anterolaterally. So the head or the glenoid cavity or the lateral angle is directed slightly upwards and laterally, and it articulates with the head of the humerus and forming the shoulder joint. And the spine or the spinous process is directed posteriorly, and the coracoid process is directed anterolaterally. So these are the important points of side determination of the scapula. Now, morphological features. There are some angles and borders and surfaces. First of all, we will start with the angles. And now if you try to draw a scapula bone, then this is the, no, start with the angle, like here is angle, here is angle, and here is a angle also. So first angle is, there are three angles like glenoid cavity or the lateral angle. So this is the glenoid cavity or the lateral angle, the LA part. Number 2, that is the medial or superior angle. So this angle is superior angle or medial angle. Number 3, that is the inferior angle. So this one is the inferior angle. So these are the three angles. One is superior or medial angle, one is inferior angle, and one is lateral angle or glenoid cavity. Now there are some borders. What are the borders? Like superior border, then medial border, and then lateral border. So these are the three borders which are present. The superior border extends from superior angle to lateral angle. Medial angle extends from superior angle to inferior angle, and lateral angle extends from the lateral angle to the inferior angle. So this border is the superior border, this border is the lateral border, and this border is the medial border. So superior border is extends from the superior angle to the lateral angle, and medial border is extends from the superior angle to the inferior angle, and the lateral border extends from the lateral angle to the inferior angle. So these are the three borders which are present. Now there are some surfaces. So what are the surfaces? First of all, anterior or ventral or costal surface. So this surface is concave, and here is the presence of costal impression. Costal means ribs. So in case of anterior surface or ventral surface or costal surface, these surfaces are generally concave surface, and here the presence of costal impression. Okay. And number 2, that is the posterior surface or dorsal surface. Now on this surface there is a process called spinous process, and so this surface is divided into two facets or two fossa, divided into two fossa. So what are they? One is supraspinous spinous fossa and one is infraspinous fossa. This part is supraspinous and this part is infraspinous. Supraspinous is above the spine and infraspinous is below the spine. And number 4 structure, that is we have already discussed about the angles, about the borders, about the surfaces. Now number 4, that is the processes. So what are the processes that is present? Number 1, spinous process. Number 2, coracoid process. Number 3, acromion process. Which is the continuation of spine. Here you can see the process. This is coracoid process. Here you can see one process, that is the acromion process, and this is the spinous process. And there are some notches also. One is suprascapular notch, suprascapular notch, and spinoglenoid notch. Here you cannot see, but here it is present supraspinous notch, and here the presence of spinoglenoid notch in this position and in this position. And there are some tubercles also. Number 6 structure, that is there are some tubercles also. So what are those tubercles? Number 1 is supraglenoid, and number 2, that is infraglenoid. Now I will try to show you the diagram part. So this is the diagram of scapula, and in case of scapula, this is the superior angle or medial angle, this one is the lateral angle or glenoid cavity, this one is the inferior angle, this one is superior border, this one is medial border, this one is lateral border. So these are the 3 angles and 3 borders. Now 3 surfaces. So this one, you can see in the diagram, that is the posterior or dorsal surface, and the behind there is the ventral surface or costal surface or anterior surface. And in the next part we have discussed about the processes, like this one is spinous process. Here you can see one process also, that is acromion process, and there on is the coracoid process. And there are some notches. Here is the, you can see the suprascapular notch, and here you will see the spinoglenoid notch. Then there are tubercles also, like The here on is the supraglenoid tubercle and here on is the infraglenoid tubercle. So these are the all structures. So we have discussed about three angles. The angles are lateral angle, superior angle and inferior angle. Number 2, we have discussed about the three borders. One is superior border, one is inferior superior border, then the lateral border and medial border. Then we have discussed about the surfaces, and we have also two surfaces. One is ventral surface or costal surface or anterior surface, and one is dorsal surface or posterior surface. Then we have discussed about the processes, and there are three processes. These are spinous process, acromion and coracoid. So these are the three processes. Then in the number 5, that is the notches. There are two notches like suprascapular notch and spinoglenoid notch. Then we have tubercles. These are also numbered in 2. What are the tubercles? One is supraglenoid tubercle and infraglenoid tubercle. So these are the all structures that is present in the scapula. So scapula is a triangular shaped bone. It is 2 in number and it is situated in the posterolateral aspect to the back of the chest. So it is present in the posterolateral aspect to the back of the chest. Then we have discussed about the side determination part. And in the side determination, number point was head or glenoid cavity. Glenoid cavity is directed slightly upwards and laterally, and it articulates with the head of the humerus and forming shoulder joint. And then the spine or spinous process directed posteriorly. Then we have discussed about the coracoid process that is directed anterolaterally. Then the morphological features like the angles, borders, surface, process, notch and tubercle. 3 angles, lateral angle, superior angle, inferior angle. 3 borders, superior border, lateral border, medial border. 2 surfaces, ventral surface, dorsal surface. 3 processes, spinous process, acromion process, coracoid process. 2 notches, suprascapular notch and spinoglenoid notch. 2 tubercle, that is supraglenoid tubercle and infraglenoid tubercle. So these are all the structures that is present in the bone scapula. I think you guys have all clearly understood what I have discussed in the video. If you have any query or any doubt, you can comment down in the comment section. I will try to reply them all. And please comment down if you have any query. And do like, share and subscribe to my channel for supporting me and my channel. And thank you so much for watching the entire video.